medius, and minimus tensor fascia lata.
Okay, how's the tensor fascia lata? How does it do abduction?
If you have flexion at the
From a flex position, it does abduction. Okay, go ahead, Patrice, please, and just tell Josh what to do.
Okay, they're on your side.
Okay.
And the hip should be in slight extension, but I get confused with that between it being straight and hyperextension.
Neutral will be good, to a little bit of extension, like 10 degrees maybe. And okay, is he in extension now at the hip?
It's like a little flexion.
Yeah, man, for a minute. Okay, so here's a common problem here, is starting with the patient in some degree of flexion, which is going to be for the tensor fascia lata. So to distinguish from that, you really need to make sure we're starting in extension, even beyond anatomical position, to make sure you're getting gluteus medius there. All right? Won't you show him what to do?
Okay. So this is going to be the motion. Make sure you keep your toes pointed forward and just kind of go with
Okay, what Patrice just said is very important here. Keep your toes where?
facing forward.
Facing
And
forward. What do most people tend to do with this one? A very common
Straighten 'em out.
substitution is to do lateral rotation, so your toes are pointing up toward the ceiling.
Doesn't that cause flexion, or
Yes.
a combination of flexion?
Yeah, you're starting to use your hip flexors, and we don't want to do that. So very important here, toes pointing straight ahead as you do this. All right, can you go ahead and do the test?
do that motion for me. And we're going to apply maximum resistance. And,
I didn't see.
sorry.
That's fine. What'd you get?
Oh, it was 5.
Good. All right, I noticed you put your hand on his distal thigh. Is that
Yes. And I can also put it proximal to the ankle.
okay? Or distal leg, you could say
Distal
too.
leg.
All right, the distal thigh is the normal place. You got a strong person and you need a longer lever arm, you can go down to the distal leg there. All right, and can we see for 0 through 2 positions?
Okay, lay on your back corner. And it doesn't matter which hand.
Why don't you do the one closest to you so we can
Okay.
see?
All right, so you want to make sure that you keep your toes and pointed to the ceiling and your knee up.
Okay, that's another important thing again, toes pointed straight up. Everybody, every patient is going to want to do lateral rotation when they do that.
And then this is going to be the motion. And can you do that?
Okay, and what does Patrice need to do here?
She's stabilizing it.
You need to support the leg.
Okay.
Because we don't want friction getting in the way, so you're not assisting or resisting, but you're supporting. He shouldn't have to hold it up with his hip flexors. He shouldn't have friction against the bed.
So this is the motion. And can you do that?
That's good. All right. And Patrice, can you come over here and show me where you're going to palpate?
It's going to be the lateral hip proximal to the greater trochanter, so the gluteus medius.
Can you show me greater trochanter on there? Uh-huh, right there. So we're going just proximal to greater trochanter. Can you get him to contract that muscle, please?
Sideline. Come back some.
Find greater trochanter first for me. You can have him rotate his leg in and out.
Here.
Yep, should be right around there. Okay, now go proximal to it. All right. And get him to contract that muscle.
And you can try to do the motion
Okay, good. And another way.
or hold.
Very nice. Okay. All right. And again, so it's very, the The tricky part with this one is preventing substitutions. It's very common for people to make various substitutions.